us and our family to make decision. For us and our family to make decision for planning care and treatment, and it also involves the preference and diversity of the individuals, and it also have the care involves by recognizing our needs and make right to health decision and our choices, and it also involves um, the right to ask the questions and complaints to about our health care. And the centered care is also known as person centered care.
Okay, thank you. So great.
That's all.
Okay, about the other students, the students from the other group, what is your opinion about the presentation? What can you tell us about this? So who can share your opinion and give some recommendations? Yes, Sohita.
I think that in few slides the template was more dominating than the text, ma'am.
Okay, I see. Any more opinions? Okay, and I would say about the design of the presentation, when you choose one kind of design, it was in pink, right? So you should, I think, girlish, yes, color. I think you should just make all the slides look like this. So because there is a kind of distraction when we see pink, then we see brown, yellow, so a lot of visual noise. You should, if you choose one kind of design, you should make all your slides like in one and the same design. So this is my recommendation. Okay, but the presentation was very informative, and you just found a lot of very useful information, and you've presented it in a very perfect way, and we see that you know what you are speaking about, and so the presentation was very good.
Thank you.
Well, thank you, and so we just go on with what we started, presentation that we started with, and so yes, okay, we are waiting for the application to open. Now we can see it, and I would like you to focus on the next piece of information. Today we are going to speak about working in general practice, and we are going to speak about jobs in clinics. And the question, you can see here several pictures that illustrate different kind of activities that people do in medical institutions. And so the question is, can you predict what each person's job involves? So looking at these pictures. Any ideas?
In the A picture, I think she is organizing the medicines. Whatever that is. In the B picture, I think the old lady is a patient, and the other sitting next to her is kind of getting her information.
Okay.
And the third one seems like a paramedic.
Okay. As for picture A, what can you see in the background? The person is sitting, as we see, at a
In a
table.
lab or yes.
Receptionist.
Receptionist.
Lab.
Yes, it looks like she's a receptionist because there are paper, so some records, patient records, paper on the shelves. Mhm. Okay. Okay, if we move to the next slide, we can see the names of the jobs here. The first one, receptionist, you were right. As for picture B, you see that this person is visiting an elderly patient at home, and this kind of job is called health visitor. And picture C, this is general practitioner, GP. So, and in picture D, so midwife, who helps just dealing with babies, newborn babies. Well, and if we move to the next slide. So here we can see 3 more pictures which we should analyze and think of for the names of the job for these people. What are they? Yes, please.
Ma'am, the third picture
Picture
is
D.
Mhm.
paramedic. First picture will be paramedic.
Okay.
And second one, I guess, is some surgeon who is discussing about surgeries.
Mhm.
And
Discuss.
G is general physician or pediatrician.
Mhm. Right. So yes, you are right. It can these pictures can illustrate the jobs that you mentioned, but let us focus on the following jobs. So let it be that this is a district nurse in picture E because she just deals with the patients in her district and just travels in a special car. And as for picture F, they are not doing any kind of medical manipulations. They are discussing the organization of medical practice. So this is the illustration of practice manager in medicine. And the last one here, you were right about pediatrician, but here we mean that this is a practice nurse that deals with patients. And well, I would like you to think of the following. What do you think is the most stressful aspect in medical work? So I think you've heard about from other people who are involved in general practice, so in medical work. So and what did they speak about, or what do you think? What is your
Yes,
opinion?
ma'am.
So please.
Like majority of them are like it's very difficult to do the night shift. Like you have to stand all the time and listen to the patients, and they're not listening to you. So it's a very difficult job to calm them down and show them the wards, etc.
Okay.
I think the most stressful aspect is when a patient comes and he's not in a state to answer medical questions like his allergies and medical history, etc. Because we don't know how to treat them. We wouldn't understand. I think that is more stressful.
See. The other ideas?
Language is also important, ma'am.
Mhm.
Language. We will give response in one language, they will give response in another language. It is also stressful to identify the disease which he got, any disease or any heart, to understand easily. If we ask one question, they will give answer another one.
I see. Okay. And the other question is about rewarding aspect. What is the most rewarding thing of medical?
Patient with gaining his consciousness after a big surgery, after his surgery.
Okay.
And
And-
responding to all.
When the patient gets happy, then the doctor also gets happy. The
Mhm.
patient's
He is
response.
fully cured. Patient is fully cured.
What about the financial aspect? So what about the salary that doctors get?
Of course, that's the main aspect.
Yes, I see. Uh-huh.
Yes. Especially if you are a surgeon, operate on patients.
Mhm. Okay, okay, great. So if we move to the next slide. So I would like you to look at the sentences, and so you see we should add the job title, a job title of the people to each sentence. Let us one more time focus on the job titles like receptionist, health visitor, general practitioner GP, midwife, and district nurse, practice manager, and practice nurse. And if we look at these sentences, let us start with the Manish. Will you read the first sentence? Sorry.
Yes, ma'am.
Please.
A practice is run by a
So which job is missing here?
practice manager.
Okay, if we speak about organizing everything in a hospital, this is practice manager. You are right. Or yes. And let us listen to Pradeep Kumar. Sentence 2. Is Pradeep Kumar here? No. What about Rohita?
Yes, ma'am.
So please
Work with individuals, families, and groups like the elderly and newborn babies in the community.
So what kind of job is it? Who can help us?
Midwife.
Health visitors.
Midwife. Midwife doesn't deal with the elderly people.
General practitioner.
District nurse.
So look, it is emphasized that
Practice nurse.
this is groups of people like the elderly and newborn babies and families. So the elderly people can't visit a hospital or clinic. So these people visit them individually at home. So what is this job called?
General practitioner.
Health visitors.
Yes, this is health visitor.
Health.
Yes, health visitors. Okay, let us listen to Bhuvanesh.
Yes, ma'am. Third one, ma'am.
Yes, number 3.
Dash needs very good interpersonal skills because they're the first contact people have with the practice.
So who?
General practitioner, ma'am, is it?
Okay. It is. They are very just. They
Receptionist.
need the interpersonal skills. But who is the first person to contact people in a hospital?
Receptionist, ma'am.
Receptionist.
Yes, receptionists need very good interpersonal skills. Okay, let us listen to Sohita,
Yes, ma'am.
number 4.
97% of the UK population is registered with a general practitioner.
General practitioner. You're right. Okay, then Afnan,
Yes, ma'am.
sentence number 5, please.
The duties of the dash include traditional nursing skills and running specialist clinics for immunization, diabetes, and so on.
Mhm. Nursing skills.
Nurse, ma'am.
Sorry.
District nurse.
Mhm. So district nurse or practice nurse. Right.
Thank you, ma'am.
Okay, thank you. And the next is for Khadija.
Actually, she messaged me that she's having some network issue. She'll be back in a minute.
Okay. What about Musharifuddin?
He's absent, ma'am.
I see. And Mayuka.
Yes, ma'am. An important link between hospitals, GPs, and other health professionals involved in antenatal natal care is the general practitioner.
We should understand this term like antenatal care. Antenatal care is caring for newborn babies. So if this is the person,
Midwife.
Midwife, yes.
Midwife.
The next is for Rina.
Yes, ma'am. Dash visit those who are housebound or those recently discharged from hospitals and or dress wounds. General practitioner.
Is it district nurse, ma'am?
Practice
Yes,
nurse.
district nurse or practice nurse. You're right. Okay, good. I hope that this activity will help us to remember the names of the medical jobs better. And if we move to the next slide, we can see there is information about how the places where the general practitioner works are called. So this is a general practitioner's place of work is called a surgery in the United States. And surgery also refers to the time when general practitioners see patients. And the question is, do doctors in your country, do doctors work outside hospitals in India?
Yes, ma'am.
Yes, ma'am, I guess.
Yes,
Because they have their own clinics like that after like working in the hospital after a few hours. They'll in the evening they'll be in their clinics to check the patients
Yes.
other than in hospitals.
Okay. Any more ideas? Where else can they work outside hospital?
Yes, ma'am, because the working in the hospital is really difficult. You have to be under the command of the government, etc. You cannot escape for go for a holiday, etc. So I have seen most of the doctors, they have their own private clinics, and they are really happy in their own private clinics and earning way more better. So I think yes.
I see. Okay. Anyone else who wants to say something?
Medical camps.
Camps.
Okay. Good. And here's another question. Which person, in your opinion, is the most important besides the general practitioner? Who is the second after general practitioner?
Surgeon.
Surgeons.
I see. You are speaking
Surgeon.
about
Yes.
specialists, yes?
Yes, ma'am.
Doctors who specialize in some area. And you were speaking about...
Nurses, district nurse or practice nurses also.
Right, because these are people working together with general practitioner, and so they help him to deal with patients and take part in the treatment. Okay, if we move to the next slide. Can we move to the next slide? Yes. Okay, we are going to listen to some information. And a general practitioner is speaking about her job. Let us listen to a general practitioner. She's talking about her work in an inner city area. And you can see here there are 5 statements on the screen, and we should decide whether these statements about her work are true or false. So I'll look through the statements, and then I'm going to switch on the recording. Do you understand all the statements? Is everything clear? For example, workload. Do we understand what workload means?
Yes, ma'am.
This is the amount of hours that the people who work during a day, a week, for example. Okay, and what does it mean, deprived areas? Deprived areas in statement number 5. What kind of area?
That doesn't have that much resources or facilities.
Rural areas.
Rural areas.
Yeah.
Not exactly rural, maybe like you say, where people...
Less populated area.
Yes. Okay. So let us start listening, and you'll tell me if you hear or not.
Listening 1. My name is Dr. Chowdhury, and I am a GP working...
Do you hear?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay. One more time.
Listening 1. My name is Dr. Chowdhury, and I am a GP working in an inner city area in London, just on the edge of the East End. I started work as a GP in this area over 20 years ago. In recent years, many developments, both technological and social, have occurred, affecting the practice enormously. I enjoyed my work here a lot at the beginning, and I still do now. But there are many problems in an area like this, which you would not find in rural communities in this country or in my home country, India. The crime rates are high, which affects the morale of the patients we serve and ultimately the morale of the GP practice. The workload is heavier than in most rural districts, which sometimes puts potential GPs off moving into the area. However, I have always found the job very rewarding. Another feature of an inner-city GP practice is that patients move around a lot. As regards compensation for working in deprived areas in the inner city, sometimes GPs receive extra payment.
Okay, that is the information. Do you understand it?
Yes, ma'am.
Yes, ma'am.
So let us just comment on the statements which are given here on the screen, and let us listen to Sai Parakavi. Sai,
Yes, ma'am.
the
The
first one.
first statement is false, ma'am. She lives in east of London.
Mhm. Okay. Then Vidya, number 2, please.
Yes, ma'am.
Read it, please.
High crime rates do not affect the people working at the GP practice. It is false, ma'am. High crime rates will affect the people working at the GP practice.
Yes, the sentence is negative, but she says that crime rates do affect the people. She was speaking about their morale and yes. Let us listen to Lahari. Are you here? Lahari. Is Lahari absent? She is absent.
She's here, ma'am.
So the next is for Manish, please.
Yes, ma'am. The workload is lighter than in rural areas. It's false, ma'am.
It's heavier. Okay.
Yes, heavier.
Then Rohita.
Yes, ma'am. Patient move from one GP practice to another. It's true, ma'am.
It's true. Yes, this is the true sentence. And the last one is for Purvanesh.
Yes, ma'am. False, ma'am. He receives extra payment.
Yes, he does. She does receive the extra payment. Okay, good. So, and if we move to the next slide, there is a question to discuss. Is there a difference in working in city, urban, and rural areas in your home country, in India? Is there a difference?
Yes, ma'am.
So
I
please,
think yes, ma'am.
what is the difference?
Few equipments does not like we can't find in rural areas, and so it will be difficult to diagnose them in rural. But slowly they are increasing the equipments in rural areas also.
Okay. Any more ideas from the other students?
Pharmaceutical facilities will be less in rural areas.
Okay. So you are speaking about some just negative points, right? Comparing urban and rural areas. Are there any advantages in working in rural areas? Are there any advantages? Can you think of any advantages? What are they?
Like rural areas, they'll not have many such facilities. If there is any dangerous situation in that person, they need to go to the urban areas. In that time, it takes a lot of time. In that time, may that person may die or else like.
Workload is low in rural areas as
What is?
compared to urban. And workload
Yes,
in
this is
rural
good.
areas,
Mhm.
it will be less than in urban.
I see. Okay.
And the doctors might have 5 to 10% more salaries in the rural areas.
Yes,
Yes.
ma'am. In Pakistan, as the doctors, they don't want to go to the rural area, so the government is like, we will pay you more, we will pay you extra if you visit this specific rural area, things like this. So they get like extra money.
Yes, yes, this is very important. Okay. And you are speaking about Pakistan. Are you from Pakistan?
Yes, ma'am.
I see. And how many students are there from Pakistan in your group?
Only me.
Only you. You are who? What's your name?
Khadija.
Sorry?
Khadija, ma'am.
Khadija. I see. Okay. All the other students are from India, right?
Yes,
ma'am.
Yes, ma'am.
Interesting. Okay. So I think this is very interesting to think about your country and to compare the working in urban areas and in rural areas. And I think that can be one of the home assignments. You should write an essay about this and write everything you think about this in this essay. I'll send the instructions for the home assignment later after the class. And
Okay, ma'am.
the essay should be about 250 words, and it should be done in, for example, Word format. And so you should send this essay to me, and the deadline, as we usually have the deadline, is on Saturday night. So that will be part of your home assignment, okay? And
Okay, ma'am.
Okay, ma'am.
if we move on, so here there is information about the two tenses. This is the language spot and the information about grammar. You remember that last time we were speaking about the present tenses and we were comparing them and just refreshing what we remember, some theoretical and practical tasks. And here there is information about the use of two tenses, the present perfect tense and the past simple tense. So there is some kind of difficulty for some people to differentiate these two tenses, because both of them, they tell us about the events that happened in the past. So it's good when the name of the tense is the past simple tense. So this is about past event. But if we say the present perfect tense, there is the word present in the name of the tense. That is why sometimes we do not understand why it's called present. For example, in my language, I speak Russian. I translate the verb which is given in the present perfect tense using the verb in the past in Russian, not in the present. So here you can see the diagram, that the timeline that illustrates the use of the present perfect tense. We use it for actions which happen in the past at any time up to now. The exact time is not known or not defined. It means that it's called present because it has finished by the present by now, or it has result in present, but it started in the past. The time is not given. And if we move to the next slide, so here we can also see the timeline for the action which is used with the help of the past simple tense. So we use the past simple for specific times in the past. The exact time is known or defined, but sometimes the time is not mentioned, but we understand when the action happened. So like here we have the time markers, like last year, 2 days ago, yesterday, like in in last century or something like this. So we need to use the past simple tense because it happened in the past and it is not connected to the present. And so let us speak about taking a history. Like taking a history, the doctor should pay attention to the patient's use of the past simple and the present perfect. It's very important. So while listening to the speaker, there is a sentence from the listening task, and it says, in recent years, many developments, both technological and social, have occurred. So she's speaking about the result, which we have in present, and the time of the occurrence of each event is not specific. That is why the tense which is used here in this sentence is the present perfect tense. And one more sentence from listening. She says, I started work as a GP in this area over 20 years ago. And here we see that the time is identified. This is 20 years ago. And that is why the tense that she used in this sentence is the past simple tense, started. So because we know the exact time. Well, so we have less than 1 minute. That is why just time, I stop sharing the screen. And so we have 10-minute break, and we'll meet after the break in 10 minutes. Okay?
Okay, ma'am.
Okay, ma'am.
See you in 10 minutes.
Okay, ma'am. Thank you, ma'am.